Well, good evening, everyone. This is Dr. Ellithorpe again with Tustin Longevity Center, and we are here every Tuesday at 6 o'clock till 7 to provide a venue for you to ask general questions about preventive medicine, functional medicine, integrative, complementary medicine, and how we would approach the needs of people uh, with natural, preventative, restorative therapies prior to or along with their standard of care from our allopathic medical training. We are a group of 7 healthcare providers here at Tustin Longevity in Tustin, California. And together we have, well over 100 years of clinical experience with the functional approach to healthcare. And we're published, and we do training and teachings on this and on various natural methodologies to both the public and to other physicians. And so tonight we begin with questions. These are the emailed questions that I get every week. I don't get them ahead of time. They're just recently dropped off to me. I have a couple of pages. And then we have on the chat here, if you're live and on YouTube, you can put in the chat some questions and we can try and get to those there as well. On the questions, this is again, of course, not meant to be personal medical advice, but rather general responses to our approach. If you have any acute problems, please see your physician and address them. If you are a patient with us, please do call the office at 714-544-1521 and speak with your healthcare provider here, and then we'll try and get back with you as soon as possible. So I don't see any in the chat yet, so I'll go start with the questions that we have today from, the first one is from, I guess it's something that came in late last week. This is from Bren. I recently, 2 months, started Lisinopril for blood pressure. Unfortunately, I'm getting a bad dry cough side effect. They tried losartan, it didn't work well. I have a low pulse rate, so beta blockers are not an option. Question, is there anything naturally I can do for the cough side effects so I can stay on lisinopril? Thanks. Bren, in general, this is difficult to manage, to be quite honest. Now, we would certainly hope that any other issues would be handled, such as silent reflux, where acid will come up silently, even without you knowing it, or necessarily having heartburn, and using things like glutagenics, glutashield, which is glutamine, zinc, vitamin A, phospholipid powders that we use, glutashield, the SBI Protect probiotics. These all help the esophageal lining and would hopefully make, if it's anything to do or aggravated from your silent reflux. N-acetylcysteine is a product that is natural, that is over the counter, and is used for the lung health as far as helping with expectoration and many of the issues of antioxidant protection of lung tissue. Being adequately hydrated, taking things that are natural expectorants. Iodine helps with natural expectoration. But I don't want to falsely make you think that this is a clear-cut answer, because in general there is no answer to the lisinopril cough. Excess weight, losing weight, and the other thing is make sure that you're not having sleep disturbances from trouble sleeping, and breathing through your mouth at night would aggravate and promote coughing. So see your physician who ordered this. There is a prescription called Tesla Pearls, TESSLA Pearls, PEARLES. These are 100 milligram, I forget the biochemical name, but they've been around 40 years. I've been prescribing Tesla pearls for the cough of Lisinopril cough side effect for many years, and that tends to be successful, but it is a prescription product. All right, so hopefully that's a help to you, Bren. Janice says, hello, I was diagnosed with Bell's palsy on August 1st, and I had it too. I don't know if you can tell. My right side of my face is a little more droopy. I had it in my 30s, about 10 weeks after I had my second baby by C-section in the military. So I know what Bell's palsy is. The doctor prescribed antiviral medicines and steroids, which I completed, then received ultrasound laser electrical stimulation treatments from physical therapists in September, October, started acupuncture treatments in November, and started treatments with physical therapy who specializes in facial Bell's palsy. Symptoms of Bell's palsy still not changing. Should I continue acupuncture, keep taking Chinese herbs, reanimation surgery, and putting a platinum weight in the eyelid to help the eye close? What treatments have been effective for those who have Bell's palsy? Thank you. Well, high-dose vitamin C is very valuable, but you have to understand the nerve damage means that the myelin sheath, the sheathing that goes around the nerve that conducts the electrical stimulation, has been harmed. And that's only by eating a healthy building block for the membranes that have an injury through them that created the damage. So when the trigeminal nerve came through, the signal's not coming through. So I would, a carnivore-like diet would be rich in phospholipids, chicken with the skin on it, roasted, nothing deep fried or with a crusty, a lot like Kentucky Fried Chicken, but fish and egg yolks and eggs and pork and butter and some seeds and nuts, walnuts, pecans, flax seeds, almonds. These have some sunflower seeds have these phospholipids in it. And we have that powdered called phospholipid, which we mix with SBI Protect, that helps the lining and the body to absorb this to all of our nerves and stuff. High-dose vitamin C improves it in microcirculation to the circulation surrounding, everywhere in your body. If you did EDTA chelation, along with the phospholipids, along with a more carnivore diet, very low carb, so you don't clog up on the little teeny tiny hair-like capillaries. And then I certainly think acupuncture will do better. This is when I was 30 when this happened to me. So that's almost 40 years ago. Fortunately, I got better, but I think it's because 40 years ago, we ate so much better back then. There wasn't so many fast food, junk food, Pizza Huts and stuff around to harm our diet as well either. So that's what I would do, Janice. Chelation therapy, vitamin C, phospholipids with the GlutaShield and SBI Protect powders. That would help you. Anthony says, do you have any suggestions for a 76-year-old woman, my wife, who is suffering from mental decline and insomnia as a result of long COVID? She does not have dementia, but has no desire to help herself, is very stoic, and claims she does not get any sleep. Any nutritional suggestions or any other information would be greatly appreciated. Anthony, this, I would say she should take vitamin D 10,000 with vitamin K2 in it. So it's a combination DK2, vitamin D3, K2. I would start with a 10,000 capsule, and then I would use the methyl B complex that has B5 pyridium in it. And then I would use a diet rich in healthy fats, which are very satiating. And again, it helps the brain calm down. I would use a multi-mineral that has magnesium, selenium, calcium in it. We have the TLC multi-min. So minerals that are amino chelated. That only comes really from the Albion source. That's what we use. The vitamin D, the B complex. We have the fat, and that would go also for the Janice, who was before with her Bell's palsy, the phospholipids, the essential fatty acids for all cell membranes here, which is the linoleic, alpha linoleic, and it's called parent essential oils, PEO, or clinician preference oil. That helps with calming the brain. Also, natural hormone replacement therapy. If you could find a natural a physician, medical doctor who could prescribe estradiol and progesterone, helps with sleep. Let's see the next one. Simone says, "Hi, Dr. Rita. Thank you for taking my question. I'm seeing a new doctor and she would like me to take the hepatitis A vaccine. I didn't say anything to her because I'm not taking any vaccine because I don't trust any of these vaccines out there today. She thinks that everyone should take the hepatitis vaccine. What are your thoughts?" Well, hepatitis A is not really any risk to anybody. If one were to get it, it's a foodborne, and it has no long-term enduring problems. You'll get a gastroenteritis, diarrhea if you were to get it, and then normally people heal without any treatment whatsoever. So why would you take a vaccine? And the likelihood of getting it is so remote, and the potential side effects of a vaccine, I think, would be a considerable outweighing of the benefit of the vaccine to the potential damage of side effects. So that's how I would approach it. I think you're being very wise, Simone, with the way you're addressing this. Carl, hello again, Dr. E. Any knowledge of the fatty acid C15? There is a company in San Diego doing research on it and producing a supplement now called Fatty 15. Normally, fatty acids are in a 2-carbon, 4-carbon, 6-carbon, 8-carbon, 10, 12, 14, 16, 18, 20, 22. So this C15 would be very new. I would be suspicious. I would have to look into that, Carl. And let me write that down. It's called www.fatty15.com. www.fatty15.com. So I haven't heard of it. He goes on to say, I have thought that you and Garth Nicholson were looking into the cell danger response before Dr. Novak's made the term popular with his research. Your solution was NT-factor, and his is to use the African sleeping sickness serum called Suramin, especially for autistic patients. Your thoughts on all this? Always appreciate your insight and knowledge, Dr. E. I'm familiar or have heard of Suramin, and I would have to look that up, Carl, because right off the top of my head, at the end of a long day of work, since being up from 5:30 and being on just working all day, it's not popping right to my forehead what Suramin is, but it's been around for many, many years. I just have to say, natural things like phospholipids that make up the membrane are coming out with power. I don't have a copy of this right now, but I just saw an article. I'll have to bring it next week because I think it's so valuable. It validates essentially what they're pointing out is everything you hear about omega-6 is bad, and the ratio of omega-3 to omega-6. Omega-6 is much higher than the omega-3s. All of this is balderdash because what these people are doing is they don't have enough chemistry, biochemistry, and they don't understand that the vast majority of all the research on omega-6 is discussing adulterated omega-6. And what do I mean by that? All the animal foods, all meats and fish and chicken and pork and eggs and dairy, all these things have, healthy essential fatty acids, nuts and seeds. And when they're put into packaged and food things like frozen dinners and such, they go through a process that hydrogenates the fats. And this is the fat omega-6 that is hydrogenated or adulterated. And we've been consuming this ever since the 1960s, because that's what my father would work on at Armor Food Research. And the long and the short of it is, if you take hydrogenated fats and trans fats, you are going to damage all your cell membranes and you're going to get sickness. Therefore, this research never clarifies, if you look at the scientific papers, that they endeavored to deal with pure, the 2 double bonds of omega-6 unadulterated. They just say it's an omega-6 certain length chain, and dealt with it like as if the double bonds being saturated or not didn't matter. And so the research coming out now makes it very clear that omega-6 of itself is very valuable in cell health and disease prevention cardiovascularly. So you have to understand, we have a corrupt system. We have undertrained our doctors, and they don't even grasp this. They don't have enough biochemistries to grasp this. So that's really what the problem is. We're hydrogenating everything, and our cells have to have omega-6. You have to have it. It's essential fat. And you have to have omega-3, but not EPA and DHA. Those aren't essential fats. We can make them ourselves out of our own delta desaturase enzyme systems. The linoleic omega-6 and the alpha-linolenic acid, the omega-3, are what we get from eating the meats, the egg yolks, the fish, the nuts and seeds. All right, so I'm going to have to look at that serum, Carl, and I'll get back with you next week. Tina, I have Hashimoto's hypothyroidism. I've been taking Synthroid for years. Is there any way to naturally restore my thyroid so I can come off this medicine? Thank you. My general experience, Tina, is once you've harmed your thyroid with an autoimmune attack, it's just like a joint that has been eaten up with arthritis. It's very unlikely that it'll get repaired. Nevertheless, over the years and depending on your age and how motivated you are, I have seen a few people come off of it with a very gut healing, phospholipid repair to the lining of the gut, food elimination and identification of offending foods, and giving the iodine. These things have helped greatly. So there is some hope. I would see a functional doctor who is familiar with how to use these therapies and see if that could be a help to you. Harlow says, hello, beautiful. You're always so sweet. God bless you always. Thank you. I need all your prayers. Can you explain why a person without heart issues have high blood pressure? And does anxiety cause fluctuations and spikes in high blood pressure? So do you treat the blood pressure or the anxiety? It's a very good question, Harlow. And the answer is stress, high cortisol moments aggravate your cardiovascular endothelial lining and the smooth muscle intima, the lining around the blood vessel, smooth muscles, and the fight or flight constriction, epinephrine surge, the cortisol surge. All of this leads to hypertension, lack of water, lack of exercise, micro damage from the higher blood sugars. Usually chronic stress will generate chronic cortisol, which creates that stress fight or flight response, and the vasoconstriction, the epinephrine dominance, sympathetic dominance, and this will drive up the blood pressure. And then it will ultimately lead to actual heart disease because the heart will be pumping against a higher resistance in the vasculature. So what we would want is to try and get, 150 minutes of exercise in every week, lots of water, use your salt to taste, and get a good night's sleep. Lack of sleep aggravates the cortisol response. Have a set bedtime routine and stick to it so you can go to bed, shut off your electronics, and go and rest, and then get up at the same time. Have your water set out for the morning, maybe some of your minerals, magnesium, and then do your exercise. 150 minutes is like 30 minutes 5 times a week of a brisk walk. You've got to exercise. And then low carb, because the high sugar will damage the endothelial lining, creating oxidative stress and vasoconstriction and damage to the delicate membranes here lining the inside of your little arteries and capillaries. So yes, you're absolutely right. Stress can do that. So treat the anxiety, and then maybe the blood pressure will come down. Of course, if your blood pressure is very high, you will have to do both at the same time and take something to relieve that as well. Andrea says, is there alternative way to do glucose test? I'm on my second trimester and due for the test, but hesitant to do it due to my age. I'm 41 and might have preeclampsia since I was checked with a high blood pressure in one of my monthly appointments. They asked me to drink aspirin. I think just take aspirin, and still didn't do it, thinking I was just that it was a one-time suggestion. When they checked it again for the second time, my blood pressure was already normal. Andrea, you need to stay under the care of your OBGYN. I don't know the specific situation, but you have to be well hydrated. You need your walks and you need your bedtime sleeping, but you need to eat whole natural food. We here with all our pregnant ladies, we give them Juice Plus for the antioxidants. We give them vitamin D, 10,000 international units with K2. We give them iodoral, 12.5 milligram tablet, one a day. We give them the TLC Energy Core, which is a multi-mineral vitamin. And we believe that is a core base. We also recommend the Parent Omega oils, which is clinician's preference. That's the linoleic and alpha linoleic acids. So I personally do not ascribe to challenging someone with a high blood sugar drink and do a glucose tolerance test on it. I think you can be just tested with fasting insulin, fasting triglycerides, fasting hemoglobin A1C, and a fasting glucose. And there's no need to add more sugar to your body to see if you have a problem with sugar. So it seems like an oxymoron to do that. But that's my opinion. That's what I think of the glucose tolerance test. I haven't used that in 30, 40 years. It's foolishness, in my opinion. Okay. Tara said, hi, Dr. Rita. I did 1,500 milligrams EDTA on Thursday, along with 1,500 milligram glutathione and a 20-gram vitamin C. Ever since, my body, face, tongue, every extremity is tingling and numb. Can you please advise as to why EDTA would cause this and how to fix it? Well, I've never prescribed glutathione with the EDTA suppository together with a vitamin C. I suppose that was the vitamin C as well. I would say that this should clear itself up. Detoxing is, let's see if it was last Thursday, so we're talking Tuesday, so that's 4 days ago. I don't think they're necessarily related. And I don't know your background, your age, your situation, your prior situations, but glutathione is going to be used up immediately. The EDTA will be gone with, normally the half-life is about 6 to 8 hours. Even with the recirculation, if you're doing the, I don't know if you're doing the suppository or an IV, but I would certainly recommend that you take your multi-mineral, TLC multi-mineral, or any good Albion-based amino acid chelated mineral, plenty of water, and exercise, and follow up with your doctor, because I don't have an answer for this tingling sensation that you're feeling. And but I don't think it's anything to do with the glutathione or the EDTA chelation or the vitamin C. All right, Mary said, Dr. Ellithorpe, when to use electrolytes and which is best one to use? Well, electrolytes are your potassium, your sodium, your chloride. These are salts, these are ions that are very important across the cell membrane for the potential, electrical potential and activities. So sea salt, Himalayan salt, these are very typical good salts to use. Just make sure you drink enough water. And you've also had gallbladder flare-ups. I really don't want to remove my gallbladder unless it's necessary. How to calm it down with a cleanse, maybe. Thanks for your advice. God bless you always. Well, the fats in our diet will stimulate cholecystokinin and the contraction of the gallbladder to squirt out so that it can help emulsify the fat as it passes through your gastrointestinal system for absorption and management until you have a bowel movement. So you would want to be cautious about the amount of fat in your diet, and you might, if you're older, take a supplement that has ox bile in it, which is in the orthodigestive enzymes. Digestive enzymes will help then ease this. Fasting will do far more than any cleanse out there. I just don't support cleanses. And I would suggest that you do a fast. Whenever you feel any GI upset, I would recommend the ox bile in your digestive enzyme when you eat. A very low carb diet, watching your fats. So maybe the leaner meats like chicken and turkey would be a better choice than a fatty prime rib or something, and maybe limit the butter you use. But that should help you. Pamela says, if I take some systemic enzymes early before my time to get up, how long should I wait to have my thyroid medication? You can take them together. I've always taken my thyroid with my systemic enzymes. They don't conflict, so you don't have to worry about that. Take them together, Pamela. Or if I take my thyroid medication on waking, how long should I wait before taking the enzymes? So once again, just take them together. They're fine. Asia says, hi, Dr. Ellithorpe. My dad has been experiencing neck pain for over 2 months. The back of his neck is stiff. He is unable to turn his head without discomfort. He tried DMSO only for a couple of days. It did not help. Can you suggest any other things he should try? I would ask, did trauma generate this? Did he just sleep with it wrong? Sometimes a virus can create what we call torticollis. Torticollis is where you get wry neck and it's very stiff and hurts. So if it was right with a viral cold, antiviral high-dose vitamin C helps. High-dose systemic enzymes, like the other patient was just asking about when to take them. If you took systemic enzymes on an empty stomach, and we're saying take like 6 or 8 of them on an empty stomach twice a day, tons of water. You could take in some magnesium. You could use moist heat at this point, and you could use some massage therapy. This should be a great help to relaxing with the magnesium and disinflame with all the enzymes. Have him see a doctor, of course, as long as there wasn't any trauma. If there was any trauma, he should be seeing a physician to do x-rays and stuff. But as we get older, we get little calcification, lipping, you call it, on the little vertebrae, and they're fast sets. They start to get like dirty, rusty, and then it pulls on the muscles and creates irritation, inflammation. So lots of water, lots of magnesium mineral, calcium, magnesium, potassium, and then the high dose of systemic enzyme, and massage, moist heat, and then if not, see your doctor, get some physical therapy, and work with it that way. Linby says, hello, I'm another grateful participant in the Freedom Tribe. Okay, praise the Lord, Linby. How would you manage this thyroid issue, even with increasing dosage of the T3 from 5 micrograms to 15 micrograms per day? The T3 lab report continues to show borderline readings. The patient is also on Levoxyl, that's the T4, 88 micrograms. The T4 is in the approved range. The TSH is 0.45. The T3 is compounded at a reputable pharmacy. Thank you for your generosity and care, Dr. Rita. Blessing. I would not, let's see. I would say I would let the T3 levels be as high as 5 or 6 micrograms per deciliter. So I would push the T3. We are underdosing the T3. The lab ranges are too low for T3. So I would feel very comfortable as long as they don't have resting tachycardia, they don't have a history of atrial fibrillation or any serious heart disease, and they are not having diarrhea from it, and they are not tremulous. I would let the free T3 dosing go up to 25 micrograms a day, and then recheck the free T3 as long as it is under 6 micrograms per deciliter and they don't have symptoms. I think you're doing fine. Chris says, good evening. I was wondering about combating urinary tract infections. I get one every couple of years. I can always tell when one is about to come on. What is your recommendation holistically? Thank you and God bless. Well, Chris, having one urinary tract infection every couple of years is not considered really chronic urinary tract infections. Usually we're talking about having a few in every year. So I'm glad it's that rare. The other thing I would say is there is cranberry extract. Uratrax is a brand name of what we use, but it's a cranberry extract. You can get it over the counter. Plenty of water. And the other thing would be try and avoid oxalate high foods. That's like spinach and kale. You could Google what are high oxalate foods. And if you see that you're eating them, many people tout them as healthy foods, but some of us are very sensitive to this. And this is your interstitial cystitis type chronic bladder irritation patient. These tiny calcium oxalate stones irritates the bladder, and it's often misinterpreted as a bladder infection. So I would stay away from oxalate, OXALATE, rich foods. I would drink plenty of water. I would take cranberry extract. And then D-mannose is a type of non-absorbable plant sugar that is in a, what is the name of that? D-mannose. It's a gran extract. What is ours called? Earache and cystatin. Yeah, cystatin, cystatin. Those are the two. One is the D-mannose sugar, and that will help prevent any bacteria from adhering to the lining of the bladder urinary tract there. So those are the things that I would do, and follow up with your doctor if those things certainly don't help you. Let's see what we have on the chat here. Garden Fairy says, I got my 87-year-old mom switched to transdermal estrogen months ago, but she never took progesterone after having hysterectomies. Could cocoa cream be helpful for her health? Definitely, Garden Fairy. I usually never like to give estradiol separate from progesterone. So I would use the progesterone cream 3 weeks on, 1 week off, 3 weeks on, and use it as a moisturizer. It's very safe. I've used it for 35 years, cocoa cream, and I rub on, 4 pumps, 6 pumps, and I put it on the arms and the extensor surfaces of the leg and the shins and calves and thighs to moisturize. So I think that'd be very beneficial. Carol says, I've had an earache in my left ear. I've tried hydrogen peroxide and Argentin 23. Do you have any advice? Thank you so much. Carol, it could be your tooth. It could also be your temporomandibular joint. So unless you had some cold or something, you could try taking systemic enzymes like Vitalzyme or the Vascuzyme and use 5 or 6 on an empty stomach 2 or 3 times a day. If you see a dramatic improvement, then you know this has to do with the joint there, right at the ear canal, which would make you ache there. So that might be it, because normally Argentin will solve that problem. Otherwise, fasting 24 hours should help heal it quickly, and then see a doctor if none of those things help. Christina says, hi, Dr. Rita. I'm in the Midwest with an air quality danger warning from the smoke from Canada. Is there a detox I can do for me and my family? Thank you, and God bless. Well, what I would do is get those HEPA filters in your house. I don't know the name of it, but there is a military product that has become civilian available. And the only place I know where to locate it is the veteran who is marketing this was brought to the Steve Bannon's war room, and there he talked about this very high quality. My eye and my allergies are bothering me. Excuse me a second while I blot my eye. And I don't know the name of it, but it was a high quality military grade anti particulate, toxic, chemical, biological, and radiological value of high caliber. So if you go on stevebannonwarroom.org or .com, I'm not sure, and then you go to their store or type in search for the air filter, and then maybe you can find it there. Now, the other thing is smoke has mercury in it, and you might want to look at EDTA chelation therapy. Another thing would be using antihistamines that are natural, like stinging nettles, N-acetylcysteine, and bromelain. The orthomolecular company has put out a product called Dehist, which is a powerful antihistamine as well. I must have accidentally touched the salt on my finger from when I put it in my water into my eye, because I'm really stinging in my right area. Oh, well. So that's where I would start. But of course, an air filter, natural antihistamines, detoxing with EDTA chelation therapy. You would have to go to an ACAM doctor, acam.org. And there's lots in the Midwest. So that should not be difficult for you to find, because that's where chelation was developed in Michigan initially. The Great Lakes Academy for the Advancement of Medicine, GLACAM, was the original name of ACAM because it started in Michigan. All right. And then Tiziana says, hi, Dr. E. What do you think about the generic vaccines for children's mumps, measles? Nowadays, autism is rampant. I wonder why. If you were to vaccinate a child, which vaccine would you choose? Well, I wouldn't. And I avoid those. I don't have a pediatric practice. I never have, because I never believed that they needed them. And there has never been any adequate testing for them. It's always a blurred vaccine group with a variation compared to another vaccine group. They never look at the children's that are a pure control without any vaccinations. Now, the Amish stand out as the healthiest without healthcare problems, autism, and various other chronic disease factors in their children. Of course, they don't use any of it. And there was a Dr. Rose, I think, was his name, up in Oregon, a pediatrician, and he started delaying or spacing out vaccinations. And then there was a certain group of patients that came to him because he was trying to do more natural things. So he attracted those kind of mothers. And so he developed a large population of parents with children who chose not to use vaccination. So he tracked them, and he wrote a paper, a publication on the unvaccinated children in his state of Oregon, I believe he's from, or Washington. And I think his name is Dr. Rose. He's a pediatrician, and it was dramatic. The difference over I think it was a 15-year period of time, he did this observation of all these children that were unvaccinated. They didn't have the doctor visits, they didn't have the antibiotics, the allergies, the neurological disorders, the autoimmune disorders, compared to the standard rate of 72 vaccinations by the age of 18. So what did they do? They took his license to practice away in Washington. So he was attacked. So maybe you could look up a pediatrician from Washington or Oregon who's a license taken away for publication of non-vaccination of children versus vaccinated children. It's very famous. It'll come up. I'm sorry, I don't remember the name. But that's how I feel about that, Tiziana. And then, of course, you could read a book called Dissolving Illusions. Dissolving Illusions. And that is by a Dr. Suzanne Humphreys. Dr. Suzanne Humphreys was a nephrologist. She was a physics major, Stanford. She had all the fancy, accolades and markers. She went on to medical school, then her internal medicine, then her subspecialty in nephrology. And what she found was the routine flu vaccinations were harming her patients and aggravating kidney failure. And so she saw that this became mandated by the hospital, and she fought it, and they fired her and they kicked her out. So she has written the book Dissolving Illusions. And even if you go on the internet, and you write Suzanne Humphreys, MD, dissolving illusions, and then write the word grafts. She has hundreds of grafts in there looking at all the communicable diseases from roughly the late 1700s through the 1800s throughout the world, because doctors have been tracking infectious diseases, polio and smallpox and tuberculosis for hundreds of years. And you'll see that the vaccine introductions really started in the 1960s, but we had already seen a drop off in smallpox and polio and other of these measles, mumps, rubella. They were all going away. And you know why they thought they were going away? Well, guess what? Better sanitation, better nutrition. Past 1920 and 30 in the United States, peace, better farming, better hygiene, sewer sanitation. The diets improved, the nutrition of children went up, their immune systems improved, and you'll have to just see this book and the actual original images of the research showing this malarkey that vaccines have saved the world is a bunch of malarkey, to use the word Biden likes to use so much. And we were already without need of these interventions with good health and nutrition. All right, so we are without any new questions. And so maybe I'll get home a little bit earlier today, unless anyone has some questions. If it's of value to you, please remember to like and subscribe and share this with a friend. And remember that down on the bar here, you can click on it and you'll get our tlcdoctors.com, our website, and you can get on our email list and notifications. And I will look up this www.fatty15.com and Suramin, and I'll talk about that. Last week, there were a few things. One of it was that Lisinopril cough, and that's what I looked up for you, Brian. But the OligoScan, Carl had asked about that last week, and the OligoScan is a system that looks at a patch of your skin spectrophomorphically, is without invading you, getting a scientific scan of about 4 millimeters of your skin as to what's in it as far as your mineral content, toxic minerals. The only problem is the first, millimeter roughly is all these dead cells, which is the corneum stratum of the skin layer. I'm not impressed with it, Carl. I'm not impressed with the OligoScan. Not that that kind of technology shouldn't be used and developed more and more, but as far as to the authenticity of intracellular mineral content, I'll go for a blood sample of a red blood cell that's then spectrophomorphically assayed compared to any spot reading on your skin where the machine goes right over it. And then that's the OligoScan. Then someone asked about methylene blue. And methylene blue is a small molecule rich in nitrogens, which is an antioxidant, but it has unique properties to be both an electron receiver and donor. And this used as like a 0.5 milligram dose per drop, maybe up to 2 milligrams a day sublingually or in your mouth, has been associated with improved mitochondrial function, and there are studies on this. And post-COVID, even the FLCC has been using methylene blue as another powerful antioxidant. I haven't used it. I haven't really needed it. And I think rather than trying to find miracle molecules, we need healthy, dedicated lifestyles. But that's methylene blue. I haven't used it. It is on the FLCC COVID long haul and recovery. Then someone asked me if I knew about Dr. Bruce Fife, F-I-F-E, and he's a doctor who has done a lot of research on coconut oil. Now, I'm in favor of coconut oil, and I looked into the work, and I think most of the benefits are because with coconut oil, he's moving people away from adulterated, hydrogenated, linoleic, omega-6 fats. So as you reduce your exposure to processed foods, you're going to see a lot of benefits. So I actually think I haven't read his book, so I can't go into depth, but this is what I'm assuming from my cursory review of quick quibs that people have said and quotes from his books. And then there was someone who asked me about Knobs tooth tablets. That's a N-O-B-S and then tooth tablets. All I could find on that was it is a dye stain that dental hygienists use, and it's a solution or tablet you chew, and then wherever plaque is on your teeth, it will attach to those cells, and you can see how well you brush your teeth, how good your oral hygiene is. That's the only thing, and if that's what they wanted me to comment on, you know, I just I'm not against it. I'm not necessarily for it. I'm for a soft toothbrush, brushed twice a day minimum every day, and so I do look up the questions and comments you asked for. I guess Chris Gile added one question here to our chat group in the chat section. Hi, Dr. Ellithorpe. This is Christine Gile. I'm a patient of yours. I'm having pain down the side of my left leg. I had a lymph massage yesterday, and I wonder if this could be the reason. Ideas to help. Well, would it be the outside of the left leg, the inside of the left leg? And is there any redness? Is there any, it's the outside, okay, of the left leg. So the iliotibial band is the most common from your ischial tuberosity and no redness. All right, good. From the outside of the ischial tubule, from the ischium of your pelvic bone attaching to the outside of your distal femur is the iliotibial band. That is the most common cause of outside lateral pain, especially after massage, and that's where the little tendon inserts are. This this can be aggravated after a massage. If you what we would say, if you bring your leg across or the other one, and that aggravates that, like you overcross your leg, and that aggravates it more, then you know indeed that this is the iliotibial band. Lots of water, warm bath, stretching, and the systemic enzymes is what I would use. And it should be better with doing that within a day. It should not get any worse. Okay, if it gets worse, then it has to be seen. But it should progressively improve after the massage and day by day, and use those enzymes. That's what I would suggest on that. All right, my dear friends, please, again, like and subscribe, share with your family and friends if this is of value. Email in your questions. I will look up things I don't know because I don't know everything. And we will see you next week, Tuesday at 6 o'clock. And let's see, do I have a good joke? Here's a joke. How does it go? Why did the bacon laugh? Why did the bacon laugh? Because the egg cracked a yolk. Because the egg cracked a yolk, a joke. Anyway, so there's one. Here's another one. Why did the old man fall into the well? Why did the old man fall into the well? Because he didn't see that well. All right, so there you go. Here's a little fun for the evening. God bless. Good night.